We are going to talk about that right now with Dr. Louis Giuffra, who joins us in the studio to talk about people's excessive drinking. You're a professor of clinical psychiatry at WashU, also the medical director for the multidisciplinary assessment program for distressed professionals at Clayton Behavioral. And we read more and more that women seem to be taking to the bottle. In fact, columnist Kathleen Parker addressed the issue this week when she announced she gave up drinking in January. Basically, she wanted to be a better role model for younger people. What do you think about this? Is there a new enlightenment when it comes to excessive drinking?
Thank you for having me, Charlie. Yes, indeed, there seems to be a bit more of awareness about the problem. And indeed, you were mentioning about drinking among women, and the gap between men and women's drinking rates is closing. Newer generations are having more females drinking than previous generations. So although traditionally alcohol problems are twice as frequently among men, among younger people, that gap is narrowing.
And while we talk about the beer industry, how they're struggling to keep their sales up, the liquor industry and the wine industry are going gangbusters. And I know in talking to some people who are in the liquor industry, they say a lot of that is driven. These flavored alcohols you're seeing on the market are all driven because women are drinking so much more. Do you have any theories why that might be?
It's probably a combination of factors, but it's perceived as a socially acceptable way of fitting in, a socially acceptable way of combating stress and dealing with stressful situations. And in general, the way alcohol use has been perceived among women is changing, and there's a little more of social acceptability to women drinking.
And women are apparently the market engine for wine consumption now. And apparently they are increasing in percentages in terms of drunken driving, arrests anyway. But it's not as if drinking is new for women, is it?
No, it's not. But traditionally, we used to say that in the chemical dependency field that women had a much worse prognosis because in order for them to be socially, to drink at a socially acceptable level and get drunk, that threshold was very high. Now that threshold is lower. And indeed, women can get in trouble much more often than before because of their excessive drinking, which has not escaped the attention of marketers. As you were mentioning, they're targeting that segment aggressively with flavored drinks and flavored vodkas, etc.
This is something that is puzzling. Maybe you can help us parse this out, but it says that although most alcoholics binge drink, about 90% of binge drinkers do not suffer from alcoholism. So how do you know when you are an alcoholic, and what qualifies as a binge drinker?
Yeah, very good question. A binge drinker is somebody who routinely exceeds the alcohol legal limit of 0.08 in their bloodstream. And that is often done when a man has 5 drinks in a short period of time or a woman has 4 drinks in a short period of time. That qualifies as binge drinking. And indeed, 90% of binge drinkers are not alcoholics. What defines an alcoholic is a couple of characteristics. The first one is tremendous difficulties stopping drinking once they start. And the second one is, despite numerous negative consequences, they're unable not to give up alcohol, and they keep falling back into the same drinking pattern. Those two things are very different than what most binge drinkers experience.
So if your alcohol is affecting your work or your family and you can't curtail it, you might be an alcoholic?
Yes. Whenever alcohol produces a lot of negative consequences, and yet the alcoholic, even though they may be repentant and apologetic, cannot stop engaging in that behavior, then we have a strong suspicion that we may be dealing with alcoholism or alcohol dependence.
What about people who do drink a lot but don't have those consequences? They're not out driving drunk, they're not missing work, they're not having necessarily family problems, but they are drinking a lot. How do you, I guess the term might be functional alcoholic. Is that a legitimate term? And how do you know if you are that and should be concerned?
Yeah, well, I think functional alcoholic is a debatable term because when you dig down, a true alcoholic has a very hard time functioning normally. But yes, people who have excessive alcohol use and are not facing immediate negative consequences may still be getting in trouble because it will affect their health and the long-term health. There will be long-term health consequences. So even among those who excessively drink and yet they say, well, I just drink at home and I don't hit anybody when I'm drunk, they still will face negative consequences long-term because of the amount of alcohol they're consuming.
Friend of mine, I'm not kidding you, used to drink 2 bottles of wine every night. Not 2 glasses, but 2 bottles. But he was still a very productive member of the community. Didn't beat his wife, had no children, blah, blah, blah. He was getting up and getting to work every day. Now, I wouldn't want to be his liver. However, would he be an alcoholic?
Well, I think it's difficult to assess an individual based only on that history, but it will be suspicious for alcoholism because chances are he can't not drink. At that point, when you say he's drinking 2 bottles of wine, to me, and yet he's able to wake up and go to work, that means he's developed tolerance. If a non-alcoholic drinks 2 bottles of wine, they'll be out of commission the next day. So the fact that he's developed tolerance and can consume that amount and not get into obvious trouble is a strong suspicion that he may indeed have the disease of alcoholism.
How difficult is it to treat somebody? I'm a former smoker, and I have discovered that I can't just have one. If I just have one, I'm smoking again. And so I often will say, to people who are trying to quit smoking, just think of yourself like an alcoholic. You can't just have one. But then I don't know if that's even a fair comparison.
It is a fair comparison because that's at the core of the diagnosis of alcoholism. Alcoholics can't stop at one. And they will try. The dream of every alcoholic, the fantasy of every alcoholic is to moderate. But life will show them that that's just impossible. The true alcoholic, once they have 1 or 2 drinks, it's like the engine gets turned on, and they just cannot stop.
So this Kathleen Parker, an award-winning columnist whose column I think originates out of Chicago or Washington, but it appears in the Post-Dispatch, she announces this week that she's not going to drink wine anymore. And basically, she doesn't want to be seen drinking in front of younger people who might be impressionable. The last line is monkey see, monkey do. But, doctor, it seems to me she's taking the wrong approach because she's making alcohol the forbidden fruit, which actually makes it more attractive, I think, for young people. It seems to me if you want to get kids to stop doing something, just do it in front of them. Like wearing an earring or a tattoo or whatever. And then,
ew, Mom.
Then they'll not do it. So how do you feel about that?
That reverse psychology might work with some, but in general, it may be that she's not, there must have been reasons for her to take this step, and we may not be privy to all her reasons. But in general, I admire and I salute people who are in the public eye and who say, look, I need to stop this. This is not right.
One thing she did say in her column that I thought was interesting is that people who drink are always fascinated with people who stop drinking. And I think that's true, too. There's a comedian, John Mulaney, who has this great whole segment about how he goes to a party and when he tells people, oh, no, thanks, I don't drink. Oh, my God, well, what are we going to have for you? We have a rutabaga here in the refrigerator. Would that be okay for you? So is that I imagine that must be a hard thing for somebody trying to quit, is that suddenly everybody's fascinated. Why? Why would you quit?
Well, I would say that I hear that rationale more often for people who are coming up with excuses why not to stop. And they say, well, I wouldn't have any social life. All my friends drink. There's no way I can function without alcohol. But in reality, when you go down to what the data shows, most people don't care. And if you're in a social situation and you say, I won't drink, you'll be surprised how that doesn't generate any rush of comments and questions and why. Unless, of course, you're going out with your drinking buddies and suddenly you change that behavior. But in a cocktail party, you simply say, no, thank you, or I'll have a non-alcoholic drink. You'll be surprised how few people really care.
Let's take a few phone calls, especially would like to hear this morning if you're out and about and if you did quit drinking. Hey, did you survive? In other words, how do people treat you at parties? Are you able to enjoy yourself on a Friday night or a Saturday night? Do you find that people are fascinated by your choice? 314, and maybe most importantly, how did you do it? Or, curiously, why did you do it? We're talking about drinking today, excessive drinking, and our guest is Dr. Louis Giuffra, professor of clinical psychiatry at WashU. He's also the medical director at Clayton Behavioral, where you see people who are trying to kick the bottle, right?
Yes, indeed. We have a very active program, and we see a lot of people who have a sincere desire to stop and who, through help, get better.
We're taking your phone calls as well, whether you have a question or something you'd like to share, 314-436-7900. And Shannon is on the line with us right now. Hi, Shannon.
Hi.
What's
How
your
are you,
situation?
Shannon?
I'm good. How are you? I have been a patient of Dr. Giuffra's for years now, and I am a recovering addict and alcoholic. And you said you were interested in why people stopped the bottle.
Sure.
Well, I have a bit of a few words for you. And when you think you're having fun, you've handed me a loaded gun. If there's a hell and I do fall, they'll serve me ethyl alcohol.
How bad did it get for you, Shannon?
Well, from what I just said to you, it got pretty bad. I've had some accidents that I didn't remember, and the police came to my job to arrest me the next morning.
That's a sign.
Yeah, a little bit. And
Yeah.
I still don't remember the accidents, but I was worried about getting in trouble because I was drinking and driving, so I just played I didn't remember, but it can just bring you down so fast. And it doesn't matter if you're doing it every day or if you're just doing it sometimes. It matters how much you're doing it. And if you can just have some drinks and have a good time and get a buzz, or if you're someone who just goes to the edge and doesn't come back.
Thanks for calling, Shannon.
Well, we'll take a couple more calls here too, but I imagine for somebody like Shannon, that's not always, because we think, oh, you had an accident, the police came to arrest you and you didn't remember. Surely you would quit then, but I imagine for a lot of people that's pretty horrific, so then they cope with that by drinking more, right? Because it's sort of self-medicating.
Well, that would be a good way of assessing if somebody has alcohol abuse or alcohol dependence. Somebody has alcohol abuse and encounters those difficulties, they can stop. The true alcoholic, as I said earlier, they may wake up remorseful and apologetic and make a sincere commitment to stop drinking, but they can't. So it will be a matter of time until they drink again. That's the true alcoholic.
Dave's on the line. Good morning, Dave.
Hey, Charlie, Debbie, Doc, how's it going?
Good. How are you?
I'm doing well. Recovering alcoholic for 25 years. Did not go to the Doc's program. I'm a grateful member of Alcoholics Anonymous and Al-Anon, recovering alcoholic, recovering drug addict. Why I quit? We lost everything. We were homeless. I had a wife, 2 kids. I got sick and tired of being sick and tired. Decided I needed to do something. What I found out through my recovery, and a big misconception with this disease, is that it's all about the alcohol. It's not. Quitting alcohol was easier than looking inside and discovering why I drank in the first place. And until I started to deal with those issues, then I was just a white knuckle alcoholic. I had to learn how to have a relationship with myself. I was always looking for acceptance, trying to find it someplace. I found it through the people I drank with. The problem was that it caused insanity in my life.
So how do you deal now? I mean, you go to the Busch Stadium, you can't have a beer. You go to a party, you don't have alcohol. You fitting in okay?
I can go to Busch Stadium and have a beer. I can go anywhere and have a beer if I want to.
Really?
It's a decision that I make on a daily basis that I'm not going to do that. And the reason that I'm not going to do that is because of where I've been and where I'm at today.
Okay, so let me ask Dr. Giuffra about that.
Yeah, I want to congratulate Dave on his sobriety and wholeheartedly support the way he's doing it. In our program, we are firm believers in AA. We take patients who at the beginning are very apprehensive and have stereotypes about AA, but to me, a successful patient, no matter what they go to treatment, to me, a successful patient is one who transitions to AA, which is a lifelong way of living and is completely free.
All right, and congratulations to him. It's 25 years. That's great. And Brad, what's your issue today?
Well, my wife is an alcoholic, and she's 5 months into the program, doing good. And I'm not. I enjoy a cocktail every now and again, and it's very, very hard on our relationship.
What do you think about that, Dr. Giuffra? I bet that comes up a lot.
It does come up a lot, and it's a matter of finding a compromise. What about your drinking might make your wife at a higher risk of relapse? I think an honest conversation can go a long way. A place for Brad to seek help might be what's called Al-Anon, which is a a 12-step community of people who are the loved ones of alcoholics. And in Al-Anon, he'll find a lot of answers too.
Can't thank you enough for joining us today, Dr. Giuffra. If folks would like more information from Clayton Behavioral, what do? Call a number?
Sure, they can call 222-5828 or find us on the website at claytonbehavioral.com. Thank you for having me.
222-5828. Dr. Louis Giuffra with us today on KMOX.